So, so I'm going to talk about what's going on in Australia in the impact space, and it's been really interesting how that's evolved really rapidly over the last couple of years, and how it's really changed a lot of the culture around what we do as well. So this is really just an overview of what's happening for us. I'm a pretty interactive presenter, so happy for any questions like in the chat box as we go, or and then obviously there'll be time at the end to have a deeper sort of discussion, but open to that for sure. So just to start off with, who am I, so that you get to know who I am. So my name is Tamika Heiden. I run a business called the Research Impact Academy, and I've been doing this for around 7 years. My background is I was a health and medical researcher for around 10 years or so, working across different disciplines of research. So my PhD was in biomechanics, believe it or not. I worked in knee osteoarthritis. I then moved into epidemiology and worked with kids with brain tumors and leukemia. And then I moved into managing more of a research centre where I worked in Aboriginal health here in Australia, and did a lot of the connection to policymakers and industry and those linkage type of activities to help with creating the impact. So my role now and what I do day to day really focuses on helping researchers and research organisations to create, capture and communicate their impact to funders, to donors, to general audiences for a multitude of different reasons. And over the last few years, that particular focus of my work has really, really ramped up. So day to day, most of my work is around training people in what is impact. So there's a little bit of that comes through in every time I present to people. So if you feel like I'm educating you. And on the other side of that is a lot of consulting. For example, I've just done just completed a big evaluation of a research funder who wanted to know whether or not they should continue to fund a big research centre. So that was a government funder, so we did that evaluation. Now I'm doing sort of stakeholder connection and evaluation stuff for another group in a government organisation. But day to day, it's really working with researchers and often helping with writing grants and writing impact statements for their grants. So just to give a bit of context around what's going on in Australia and so that you understand what I'm talking about, and I apologise right now if I sort of revert to these acronyms for our funding agencies. So I just wanted to sort of tell you there's two major funding agencies I'm going to talk about to really describe what's happening here in terms of impact. So we have one funding body, our Australian Research Council, who basically funds everything except for health and medicine. So they do all the humanities, they do the arts, the engineering, the agriculture, they do everything except for health and medicine. The other council is our Health and Medical Council, so National Health and Medical Research Council. So there are the two big guys that we have in Australia. There's lots of other funds, of course, but these are the big ones. And so what they do really drives culture, drives how we really approach things. And they're both what we would call our category 1 funding, meaning they're more prestigious. If you win funding from these, it's more prestigious. And it's something like, you know, in the US, it would be like getting funding from, is it NIH and NHS and things like that. So also, I want to talk about the difference that we have happening here around how we're asking for both retrospective and prospective impact. So is it impact that's already happened, or is it impact that we're expecting to happen? I want to talk about our national assessment because we have a national assessment now. And then I'm going to talk about how impact is showing up in our grant applications. So really giving some context around what's going on for us in this space. So it is showing up for us in grant applications, and that's been the really biggest one in the last few years. It's really started to just kind of come in slowly and creep its way in under different terms. So not always using the word impact, but we're seeing it in both of those big funding agencies now, and I'll talk more about that. We're also starting to see it in promotion and tenure type of applications, which is helpful. It's much slower than everywhere else, but it's important. And we had an engagement and impact assessment, the EIA, was our Australian impact assessment across the country. And so they asked us to write case studies for that from the universities, and I'll talk about that as well. But we're also seeing it show up in government documents and annual reports for different organisations. And so we do a lot of work with people who need to report on their impact in order to get donors to continue to fund them. And so we see it in those non-government organisations and other philanthropic type bodies. So first, I'm going to talk about our national assessment and what that looks like. And most of you here may have even heard about what's going on in the UK. They did the Research Excellence Framework and they had the assessment there. Well, we have what I call the baby ref. It's not even close to being seriously like it. It's really small in comparison. But we had a pilot of how we should do this assessment in 2017. And then we did the inaugural kind of full collection, if you like, in 2018. And the purpose of it was to really see how researchers are engaging with end users and to look at how universities are translating research into economic, social, environmental, cultural, and other impacts. So that was the whole gist of why they wanted to do it. They broke it into 3 elements that we're going to assess, and that being the engagement assessment, impact assessment, and then they had this other little element called the approach to impact, where they wanted to find out what were universities doing to support the creation of impact. So this is the definition that they used. So essentially for this particular assessment, it was anything to do with how research was being used outside of academia. So it didn't matter if your work had been used in curriculum in academia or to further research, that was not important. They just wanted to know what had happened more broadly to society. And they had these different categories of economy, society, environment, culture. They also found when they did the pilot, and this was kind of scary to me, but when they did the pilot, they realized that people didn't understand what a research end user was. And so they had to provide a definition of an end user. And as someone who worked in this space, I kind of went, really? We have to tell people what an end user is? But anyway, this is the definition they came up with. So essentially, you know, someone external from research who will benefit from or who will use the research results, which, you know, to me was a little obvious, but anyway, they defined it, which was helpful. And then research engagement. So again, we had part of the assessment was really about engagement. And so they came up with this definition of what is engagement, being this interaction between researchers and research end users. So again, that two-way interaction. And the word I like in this one was mutually beneficial transfer of knowledge. So these were the sort of the definitions underpinning our national assessment. So they used these metrics for engagement. Now, for those of you who've done any engagement with stakeholders and users, these particular indicators are really awful, and you don't really need to understand what HERDC, essentially these are our research categories that they use here in Australia. But essentially what you do need to notice is that the things that they were using to measure impact were whether or not a user had given them money. So had industry given them money to do the research, had industry commercialized any of the research, or what income had come back to the university from commercialization, was the grant, those category 1 grants that they'd gotten to do that work. And really to say, you know, had they gotten money from industry? That was the big one. So our categories 2, 3, and 4 that you can see listed there are money that comes not from those big funders, but comes from industry or comes from business or comes from philanthropy. And so what they were doing is saying, well, if you got money from philanthropy or from industry, that's our measure of engagement. It's a really poor measure of engagement. When you look back at the definition, when the definition is about mutually beneficial transfer of knowledge, this is about money. And so our assessment is flawed. And Interestingly, we just had a big review, and they asked people to put in these submissions, and so I rewrote their engagement definition for them based on these metrics. And I said it really means that the definition needs to be: engagement is considered the sourcing of funds and commercialization opportunities from external parties to benefit research. Nothing to do, and they laughed. And so the reason that these metrics came about is because government bean counters wanted something easy that they could show on a bit of a dashboard that there was something successful happening. But the problem was they called it engagement, and it's not really engagement. So our assessment ranked impact and engagement in these 4 ways: so high, medium, and low. And honestly, you know, highly significant versus significant contribution versus little or no, I mean, it's really vague. There were no real numbers around this. For all their want of metrics, it was a very vague type of way to assess this, and they had these international assessors as well looking at this. And so again, I said this was like a baby exercise compared to the UK. So for us, our engagement and impact submissions, the number of submissions that we had to do based on what they selected, were around the 600 mark for each of those, compared to over 6,700 in the Research Excellence Framework in the UK. So we did a minute little experiment. And out of those submissions, you know, it was less than 50% that ranked in that high level. And that comes down to a couple of things. One being that universities were really unprepared and didn't know how to prepare these statements. And we hadn't been capturing our impact over time. But the other is that assessment piece as well. And when you break down your assessment into those 3 elements of impact, engagement, and engagement is not actually measuring engagement. It's very hard to assess something as high or medium. So apparently there was a lot of feedback from the people reviewing these things as well. But anyway, that's the first part. So this is the assessment part of impact that's happening in our country. I don't recommend this. In talking to them, they kind of said to me, well, you know, really we want to know if it changed the culture. Did it change the culture of people's approach to impact? And the answer to that is no, because the exercise was too small. Most researchers don't even know this happened. So now I want to talk about impacting grants. And this is where we do see culture change, because most researchers are applying for grants. And as soon as you start asking for it, they start caring, but also it's their livelihoods. I don't know what it's like for you over there, but here, a lot of our researchers are on soft money. So essentially they live 5 years to 5 years or 4 years to 4 years on grant money. And if they don't get the grant, they don't have a job, unless the university will pay to keep them in till they get the next grant. But typically they're not on a salary that's based in the university. They're based on soft money from the funders, which means they have to win funds. So we have these 2 kind of elements in Australia. So we have the creation. So that's the prospective impact, and then we have the assessment side, the retrospective impact. And our prospective impact shows up in these grants from our big funding agencies. So the first being the ARC, and the other being the Health and Medical Council, and then other grants that are asking around knowledge translation or knowledge mobilization. And I'm going to talk a little bit more about that. And then we have the assessment side, which is looking at retrospectively what impact has happened. But what's been really, really interesting in looking at things retrospectively is that one of our major funders, the Health and Medical Research Council, decided in their wisdom to ask researchers to write impact case studies as part of their track record. So when they're applying for funding, they have to write a case study of impact they've had before as part of that grant. And that has been a game changer.
Excuse me, Tamika?
Yeah.
I'm sorry. I don't know if you mind if we jump in with questions along the way.
Jump in. That's fine. Go for it.
I raised my virtual hand, but I will lower it now. But just going back to what you said about how most of your researchers are on soft money, but you do have a tenure system there, right? So I'm trying to figure out how those 2 things work together.
Yeah, great question. So as you get more senior, the university will pay you a salary. So if you become a professor, they're going to pay to keep you because you've become really valuable. But most of our younger, early researchers, they may have some part-time teaching. which will keep them in the job teaching, but that's not going to pay their full salary. So the university makes decisions about if they don't get their funding for their research, are we going to keep them on or not? Also, they might be seen to be more valuable, even if they have a teaching role, if they're bringing in funding to bring through students, masters, PhDs, honours students, to do more research. So their reward mechanisms internally are how much funding are you winning, how many grants, how many students are you graduating, how many papers are you publishing? And so those mechanisms really drive that kind of behavior. But often in order to publish lots of papers and supervise students, you don't want to do too much teaching. So there's a balance and trade-off here. But there will be researchers who don't do any teaching, they just do research. But that contract to contract, and even our people who are lecturers and are teaching are on contracts. We have a lot of short-term contracts. It's been something that's really been a thing that's come up with COVID, with a lot of the universities reducing their money and having to fire all these people because they're on short-term contracts or casual contracts even for teaching. So they might have research funding that gives them their job for 5 years, and they put them on a casual contract to do some teaching as well.
Okay.
So we have a really sort of messy system. Yeah.
Yeah. I mean, that's fairly similar to what you described to our system here, but I wasn't sure if there were any significant differences. It sounds pretty similar to the.
Yeah, it's good to know though. Yeah, no, that's really, and it's interesting for me to know as well how the system works there. So thanks for the question. That's good.
Yeah, thank you.
So I'm going to talk about these retrospective impact sections. So as I said, they were asking researchers around their track record for impact. And what's really interesting out of that is that a lot of researchers were kind of going, oh my God, I don't even know how to write this. I don't know if I've had an impact. And so they introduced this just last year, end of the year before. So end of 2018 was the first time they introduced case studies within grant applications to say we've had impact before. And when they introduced these, it was into 2 particular grants, but both in our Health and Medical Research Council. And 20% of your track record is based on your impact case study. So, 20% of your grant is based on impact case study. So 30% is based on what you're going to actually do the research on, so your research program. 35% still on those publications, but 20% on your impact case study. And as you might imagine, this created a lot of work for me. I wrote 160 case studies in the last 12 months. So it's been a massive undertaking. And I've also had, because of this, a lot of people who want to know more about how to do this and write about impact. So this is the definition, though, from our funding agency. And what's really important and really, I think, cool in a way, is that they said impact can be knowledge impact. It doesn't have to be external to academia. Thank goodness, because how does that help fundamental and basic scientists, right? So they've got this really inclusive definition. So it's verifiable outcomes that research makes to knowledge, health, the economy, and or society. And importantly, it's the effect of the research after it's been adopted, adapted, or used to inform further research. So what's really great about this is that it's inclusive of knowledge impact. It doesn't have to be external to academia, because otherwise you've got a whole raft of scientists who are never going to get funding because they work in the lab and their work is not necessarily, changing practice in a hospital, but it's solving other types of problems. So the instructions also that came out with that, which were really nice and clear, was really to help researchers understand some of this language around adoption, adaptation, used, having to be verifiable. So needing that evidence, which has been really tricky because obviously we haven't been capturing that before. And also acknowledging that impact can be a decision not to change something, not to use a new diagnostic treatment. It might be that the research that's done finds that everything that's happening right now is the perfect way to do it, so we don't need to change anything. So, so that was kind of really great to see that they were asking for this, but they were also not singling out those researchers who were working in the clinic, in the basic and fundamental sciences. So they came up with these 4 types of impact, and this is where they really start to get themselves into trouble though. So they wanted or they want researchers to tick a box. Which type of impact are you going to write about? And it's not as clear cut as that every time. But these 4 types of impact, so knowledge is, use within further research. And I'll give some examples of that in a minute. And health is, new therapeutics and diagnostics. Economic, new jobs, new industries, commercial outcomes, and social being improvements in health and society and access to services and things like that for social. So these are the 4 kind of impact types that they focus on. And within that, they separated out this case study into these 3 key sections and asked for, what do you want? These are the 3, what did you do? So essentially the way that I pitch this is to say, the funder is asking you, are you worthy of funding? Have you spent the money that we've given you responsibly in the past? We want to fund people we know who create work that's going to be used by others and do more meaningful things than just be published. And so they break it down into these 3 sections. So the first being that you talk about a program of work and the impact that it's had. The second being, did that research contribute to the impact? And so you've got to prove that. And then the third being, you as an individual who's writing this in your track record, did you do more than answer the phone on this particular project? Were you part of it? Did you actually do the research, win the funding, write the papers on that sort of thing? And I wanted to just talk about this particular model that's kind of, so we talk about logic models and you would have seen an impact logic model before, but out of doing all this work and these 160 odd case studies, there were some flaws that I noticed coming up in people's logic around impact. And so I've gone ahead and adapted the logic model to help people who were writing these case studies. And so I thought I'd share it with you just so that you have it, always the teacher in me. But essentially, the purple column is really around our pathway to impact and the co-creation of research, which doesn't happen all the time in like the basic and fundamental sciences, but for more applied work, it does happen that way. But the really important part when we're talking about this pathway and these impact case studies that people are writing are to get researchers to start thinking about this grey column. What are the deliverables that came out of the program of work that you worked on? Who used it? So having the user there. Typically, we don't have the user column in these particular logic models, but I think it's really important. I will just say it's not a linear process. We know that it's a non-linear process, but this is a great way to be able to explain the process to people, even though it's non-linear. And it's a nice way to be able to step people through writing about it as well. But I definitely acknowledge that it's very hard to put this stuff into a model, otherwise it would be very messy. So always having that user, and then because someone used it, you have the outcomes, which are early impacts. So what's the change that happens because of the project or the program of work that happened? And then the impacts are that measurable change. And that typically doesn't happen for many, many years. Most of the people that I work with of these 160 odd case studies, they're in the green column. They're having early impact, but we don't have any evidence to show the longer term impacts, and that'll change over the years to come. And that's what they found in the UK when they did their big experiment, their big assessment. And then I just have this simplified model. So this just helps step through it a little bit more simply. So what you do and deliver are those outputs, who you deliver to, the adoption, uptake or use. So that's that language again of the output. And then the long-term impact is that consequence of using the output. The other thing I'll mention here is I sort of talked about the excitement of this knowledge impact piece. And I love that they did introduce knowledge impacts. But what was really scary for me was I was like going, wow, what's a knowledge impact? Because they didn't use this in the UK. They really don't use this anywhere. I'm starting to learn now, I'm doing a bit of work with Ireland, and I'm starting to see that they're using something similar to this without calling it knowledge impacts there. But essentially this was to say those fundamental and basic scientists can still claim impacts, but it's going to be really different. And so I was scratching my head kind of going, what is it that they're going to be able to claim? And as we went through, I realized that there were all these other elements of outputs and outcomes. So when you started looking at that framework and that model, it made it much easier. And so these were just some of the things that came up as knowledge outputs and impacts from that. So, you know, data sets being used, so publishing data sets, new methodologies or test procedures or statistical analysis or different new designs that were used by others, textbooks, or having shared that knowledge in a book chapter. And then, you know, we had one person who said, oh, well, I don't really care about my textbook. Turns out the textbook is actually used in all undergraduate teaching across Australia. So that's one heck of an impact. And then obviously your research publications and citations and invitations to speak. And so we really started to be able to shape up more things around that knowledge impact. And just a couple of examples also from, you know, from that model and way that we look at things. So again, knowledge, you know, to give this example, we have, there's a study that was done. It's a big global study now, but it was called the Million Women Study, and it was about hormone replacement therapy and breast cancer. And that really started off as a small study where they created an initial survey tool, and then they were able to start building up their data sets. And what happened there is they then, their users were other research teams and teams internationally, and that led to new funding, bigger studies, and they continued to use that survey tool. And that longer term impacts have been, you know, that longitudinal data they've collected, and they've now tested or surveyed over 1 million women. So you can see how that builds along that pathway, and that's a real knowledge impact, because it's about using a data set, using a survey tool, but also about getting more funding, growing a study. And then just an example of health and how that sort of fits across that pathway as well. So, you know, talking about the publications, talking about the policy briefings, talking about how, you know, they negotiated with different people in that space. So this was about folate for reductions of spina bifida births in particular. In Australia, they worked with the flour millers, who have now fortified all of our bread making flour with folate. So they changed the policies. They got industry to start changing the way they were doing things. They raised a lot of public awareness, but also what we've seen now is they've done some research and shown that the spina bifida births, particularly in the Indigenous populations, have reduced to 0 in many of those populations. So you can see that impact over time. So I want to now talk about our other funder and how they really talk about potential benefits and potential impact. So that was about case studies and the impact you've already had, but we're also seeing people ask for what's the potential impact that you expect to have. So this is more those pathways to impact and talking about that. So in our other funder, the ARC, who funds everything else, they have these 3 kind of areas of what they call benefit. So advancing knowledge, of course, because it's still, they want that knowledge area. Economic, commercial, environmental, social, or cultural benefits for Australia and international communities, and also contribution to capacity. So whether or not it's linking to our priorities for science here. And what we've seen in terms of the culture change, that particular funder is asking around benefits. And a lot of people kind of ask me the question, what's the difference between an impact and a benefit? And what I'll say, and what I say to them, is that it's the same thing, they're just using a different language, because whether or not you're benefiting someone or impacting is the same thing. So in their funding, it's all about writing about what's expected to happen. So they're talking about the potential for change, the potential for use, and writing in that way to speak about the potential benefits. And we're seeing that in a lot of grants now. We see it in our philanthropic funding. We've seen it there for quite a while. And we do see it across many of the other grants as well, where they're asking about potential impacts. And we see that a bit more internationally as well, that forward thinking rather than the retrospective case study stuff, which seems to be quite specialized. So in terms of culture change in Australia and culture change for impact, what have our drivers been? So we have this national assessment and they wanted to change culture, but really it's not been an exercise in changing culture. But grant bodies do change culture. And what we've seen is that the introduction of those case studies in grants and also the prospective impacts has led to a huge change in culture. And the reason I can say that is because of the number of workshops I now have to run and the number of grants I work on and the people who are constantly saying, no one else does this in Australia. Can you help us? Can you teach us how to do this? And so I have seen that really ramp up over the last year in particular. But we still need extra support for this, so they've just introduced these measures, and often they have introduced them and they're asking you what your impact's going to be, but they're not funding those activities. So they're not funding your engagement. They're not funding the activities to create impact. They're just asking you if you've thought about it. Researchers need the training and how to do it, right? How they're going to create their impact, how they're going to capture that. How are they even writing about it? Because we're writing about this in a really different way now. So the writing has changed. And this is the big one for people, is getting their head around how to write about impact. And the reward mechanisms, because even though it is being built slowly into some of those promotions, what we're seeing is that it's slow, and that's at the upper echelon. So that's more at the professor level where you are applying for promotions. We're seeing questions around impact, but not at the lower levels. But what's really interesting about reward mechanisms is that researchers will say to me, we're not rewarded for impact. But the thing is, they are, because they're rewarded for the numbers of category 1 grants they get from these 2 big funders. And so by proxy, they have to write about impact in those grants to win them. So they are rewarded for knowing about impact or writing about impact, just not in that direct way from their universities. It's an indirect way. So, it's kind of getting them to really think about, you have to understand impact to get funding, so you do get the recognition back from your university. It'd be great if it was just the university recognising those activities. And I know in places like in Canada and they are now rewarding people for those translation activities they do, and that can be very much part of your promotion. We're not quite there yet. It's starting. They love numbers. Money from industry is still going to be a big one here. It's just something that they love. It's not always the most effective thing. Just because you get money from industry doesn't mean you'll ever get it again, or that you worked well with them in the first place. And then I just wanted to touch on a couple of things from New Zealand, because I said I would, but also because we're seeing some really similarities. So in New Zealand, they don't have an assessment. They don't do a retrospective assessment. They do this prospective looking, and I'm sorry for all the words, but I just wanted to give you the information. I hate wordy slides myself, but I just thought you might want it. So they have the Health Research Council, who just in the last few years has really started to introduce this pathway to impact in their grants. So again, asking what is the potential for impact? How will this work benefit New Zealand or benefit others? And they're using this social, economic, cultural, or environmental. And to do that, they're asking these 2 questions. What types of benefits are expected to arise? Who will benefit? And what activities will you undertake to maximize the benefit? So what are your outputs going to be, and how are you going to share those with those users, essentially? And how are you going to engage with people to make sure you have that handoff of knowledge? The other funder in New Zealand is, so that was their health funder. This is the other funder that sort of talks about all the other things. So agriculture, engineering, the humanities, the arts, and they ask for implementation pathways. They also ask for impacts and benefits for New Zealand, and they've been doing this. I've been working with them since around 2015, I think they introduced this in their grants. So they were ahead of us in Australia, where they really started to talk about impact. And they also asked researchers to outline what the impact will be 2, 5, and 10 years after they finish their work. So they're asking them to extrapolate that out to suggest what they expect will happen. And it was funny because they were talking about doing an assessment. And I said, that's easy. You already asked them to write about what their impact is going to be at 2, 5, and 10 years. Just go back in 2 years and see whether or not it happened. And they're like, what do you mean? I said, well, you already asked them. You've got something, you've got a measure already. And they didn't kind of get that. But I thought it would be a really easy way of assessing, because they asked them already, they funded them. So let's go see if it happened. It'd be a great way to measure whether or not it's effective to ask the question too. But stakeholder involvement is a really key aspect of their funding. So having that built in from the beginning. Obviously, not going to happen with the more fundamental. This particular fund doesn't necessarily fund the fundamental area. They have a really specific granting body or granting fund that looks at that more fundamental and basic sciences. So they've pulled that out into a separate sort of pot. And I just wanted to finish off with a couple of lessons and insights. Like I said, I've been doing this for a while, and what I've seen, because I think the issues that I've seen with the researchers here in Australia and in New Zealand, they're the same with researchers I've worked with everywhere in the world. And, you know, at the moment I'm working with a group in Ireland, and it's the same questions and the same things that keep coming up. So the first being that people, you know, when they're writing about impact, they delve straight in and they say, the impact was this. And it's like, what's the context? They're not providing what the problem was they were solving. So what I'll say to anyone who's going to write about impact, you first got to tell someone there was a problem before you can tell them that you changed it. So don't just talk about the change, talk about what it was that you set out to achieve, then talk about how you changed it if you're doing retrospective. If you're doing prospective, tell someone the problem and how you plan to, or what you're doing and how that has the potential to change that problem. When we tell someone the problem, nice and short and sweet, we don't want it to be too verbose, but if we can tell someone that a snapshot of the problem that we're setting out to solve, we make them care about it. And if you can get a grant reviewer to care about a problem, they'll read it with a different light, you know, they'll think about things differently. So a lot of people just delve in and go, this is the impact, or this is what we will do. But you've got to provide some context and provide a little bit of lead into the importance of that before you do. And for anyone who's seen Simon Sinek, Start With Why, the TED Talk, that is a really valuable piece of information. And if you haven't seen it, I highly recommend it. Simon Sinek, S-I-N-E-K, just Google it, TED Talk, Start With Why, and it really highlights this starting with why to get someone to care about what you're writing. And it's a really valuable way of pitching things. Talking about the process. So what I see a lot is people talk about dissemination or communication, but they're not talking about what happened because of that activity or that action. So people will say, we disseminated to this, or we put it on a website, or we published this paper, or we did a public seminar, but there's never anything past that. And so when people just talk about the process, they're not talking about impact. So it's that next step. And that's why we added to the logic model, we added the user column, because if you don't talk about the user or the beneficiary of that sharing knowledge, you can't talk about what happened because you shared it. So you have to talk about that, the benefit. And the other one that we often see is that people make these really broad statements. And what I'll say is you need to be specific. So we see people say, this may, you know, change how we operate in whatever way, or it may has the potential to change policy. Well, that's just really broad. You need to say has the potential to change policies for whatever it's for, that affect up to however many people, or that cost us so much. The specificity, people aren't going that extra mile to show what the indicator might be around the change that's expected, or how you might even evidence that. So by that, what I mean is if you say that this, you know, 30,000 people are affected by this particular policy around transportation, as an example. So changing that policy may, or, you know, it might even be 30 million people, but changing that policy has the potential to impact that amount of people. What would you expect to see from that? So sort of taking it that next step further. So we see people make this really broad statement, you know, we'll change policy and practice. The other one we see is we will publish papers and go to conference presentations and give conference presentations. It's way too broad. It doesn't show me what the benefit will be. We will present at a conference focusing on clinicians, because we know this will be our target audience. The reason we're presenting to them is because we believe this information is relevant to their daily practice and will help them make decisions about what to implement, or, you know, really specifics. So rather than those broad statements, or we're going to target particular journals rather than we publish papers. So we're targeting this journal because we know that the people who read this journal are our ultimate audience for this information. So being specific. So just finally, we still have a lot of challenges. It's not all over, and it's not all over for anyone. I don't think, if you talk to people, even, you know, you think about these people who have big assessments and who've been doing this for longer than we have, and what you realize is everyone's still working this out. So for us, the challenges are that there's been these really steep learning curves around impact. It's just been thrown upon a lot of people without too much discussion about it. Suddenly, it's become a really big part of our grants where before it never was. So researchers are suddenly going, well, why are they asking for this now? Because they never funded us to create the impact, but suddenly they want to know whether or not we did. So it's something they were never funded or trained or rewarded to do that suddenly they now have to write about. So it's been a really big steep learning curve, but also there's been a lot of angst about it. And the other one for us is peer review. So as much as I'm really glad that impact is part of our grants, the problem we have here in this country is that our peer reviewers for grants and our peer reviewers for anything to do with impact don't know impact. And so we have academics, scientists assessing impact, and they're the same scientists I'm working with who say, I don't understand impact. And so what we often see, and in looking at those grants that have been successful and looking at those that haven't been successful and having people send me their scores and send me their statements, their impact statements, I have seen people scoring. And so, for instance, in the health and medical one, they have this score of between 1 and 7, 7 being like the highest perfect score. And I've seen people scoring, you know, high 6s, 6.6 for impact case studies that don't even talk about impact they did or anything that was related to their work, or don't even talk about impact because people don't know how to score this particular piece of work. And oftentimes I'm getting sent things that I wouldn't even give them a 2. And I've never seen anyone score below a 5 because they don't know how to score them. They don't know what they're scoring. And the scoring that they're giving them is vague, like incredibly vague. It's things like significantly contributes, it's outstanding versus exceptional versus good versus poor. I mean, that's really bad kind of guidance. So we do have those issues. In some countries, including New Zealand, they have an impact panel that they bring in industry people to assess impact. So industry, business, people who know about impact assess impact. And so their grants are going to a panel of scientists and they're getting ranked for scientific excellence. And then if it ranks high in science, it goes then to the impact panel and they rank it for impact. So you have to have great science, first of all, but then you go through to the impact panel. But they've got the right sort of model there. And one of the places I'm working with here in Australia, a smaller funder, but in the medical space, we've now got 2 panels. So I run an impact panel to assess their grants, so that they've got to be scientifically excellent, and then they come to us on the impact panel to do that. But peer review can be a really big issue because people are putting their lives, their money, their heart and everything into writing these great case studies for impact. And then the peer reviewers don't even know how to review it. So we still have these challenges that are frustrating, but it's okay. We're all on a learning curve, and hopefully we'll get there in the end. So that's the Australian context, and I'm really happy to discuss or take any questions. I'm hoping that's what you were happy to hear about today. Yeah. Thanks, Jory.
I'll do it electronically too. That was great. Thank you. Do you mind if I start rattling off some questions?
Rattle away.
So first, I apologize. I had someone knocking at my front door, so I had to step out for 5 minutes right in the middle. And that might have been when you addressed the question I'm about to ask. But
so if your question's really hard, I'm just going to say I address that in the middle. No, just kidding.
And everyone else can go along with the lie. So I was just wondering how much, if at all, how much pushback or resistance do you see from researchers who look at this obligation to report impact as a burden? And just to preface it, I'll say that Megan and I were sort of just commenting that we see a lot of similarities between what you described in Australia and what we see here. And one of the things that we do hear is a lot of researchers say, you know, I'm a researcher, just let me do my research, and this is all a distraction and a waste of my time. You know, it's something we encounter a lot, and I'm wondering if you see something similar in Australia.
Yeah, great question. And yes, absolutely. So when I started this, I was very much around helping to train researchers around knowledge translation. So how do we translate our research for the purpose of impact? So impact pathways. And I did get a lot of pushback from people because they were sort of saying, but Tamika, I'm a researcher. This is not what this is not my job. This is somebody else, or whose job is it? And I don't have time for that. And the answer to that part of your question is that that's when engagement becomes a big part of the picture. And this is the thing I think a lot of people forget. Partnership, collaborations, having stakeholders involved is not just about having a name on a piece of paper or the money they might bring. It's actually about the support mechanisms that they bring as well. So what role can they play in order to do the translation or to make sure that the report that you deliver is relevant, but also put into action on their end? So it's about doing the research, but it's about having that user to hand off to. So who is the user? Are they involved? Do they care? Is what you're doing relevant and contextually appropriate? And so that is the piece that I think doesn't get thought about. The extra element then for the researcher is actually about managing relationships. But usually we can see there's people on the team who are better at that, or they can come up with other clever ways to do that. So that overcomes that. And it's something that we have to educate people, because researchers will have a lot of backlash about that and kind of be going, oh, until you say, but that's why you work with other people, because this is not something you do on an island. And I think, unfortunately, with PhDs, we train researchers to work in silos. So we have to train them to not work in silos and to tap into every expertise around them, whether that's the librarian, the research managers, the statisticians, other things around them to tap into, and industry and other partners they can bring in. The thing that's worked really well for us is that introducing these impact case studies within grants that people really want to win, the funding body has enough, people will bitch and moan about anything, right? But the funding body has enough pull that the researchers have just gone, we have to do this and I want funding, bring it on, let's do it. And so they've just, kind of gone with it because they've been told. It's not like they've got a choice, they have to do it. The people we work with are usually kind of going, they're usually pretty happy, actually, because when you start to talk to them and you go, wow, you've had some really amazing impact, your work has been really valuable, and they love that. And some of them just love the fact that they've got this opportunity to really kind of see how valuable it's been. And because that's ultimately why they got into this in the first place. So taking that away from being a burden to being a way to showcase their expertise. We've still got a way to go for sure, but for the most part, the people that are coming to me, they're happy to do it. They know they need to do it for the funding body. And the other thing I'll say to that is that we have an assessment in Australia that has no money tied to it. So our assessment, you don't get any money, you don't get any reward. One of our major funders said, we're going to do this assessment. And all of the universities jumped up and down to do it. I said, what's the penalty if you don't? Nothing. But they all did it. So when the funders talk, people jump. So I think it's been a really good driver in that regard.
Yeah, and again, a lot of similarities, I think, to what we see here as well. So, I think what we try to do within ARIS is get them to view it less as a burden and more as an opportunity. That's sort of our big pitch. It expands the potential of your research rather than seeing it as a burden. But that's great. Thank you for sharing that.
Yeah, no worries. No worries. Thank you for the question. Anything else? Any other questions? Thoughts, comments?
I do have another question. I was just trying
to
go
for it.
Let other people go. But, one of the other situations that we encounter here is that, now everyone knows they have to do broader impacts if they want to get an NSF grant, but a lot of institutions, a lot of universities haven't really caught up with that yet in terms of providing the support internally to help people do a good job with that. Yeah. So, the people who are involved in ARIS are the people who are doing that usually at their institutions. But if you pick a random institution or across the US, the odds are pretty good that there's no one there to provide that specific support. So I'm wondering how that compares to what you see in Australia. Or do most institutions now provide that institutionalized support?
It's a real mix. Yeah, same. So there are some people in the institutions who get it and provide support. Um, there's people who provide support that don't get it, which is scary. um, and then there's people who get people like myself and my colleagues in to help. So it's a bit of a mixed bag. So ultimately, it's created a lot of work for me because there's not too many people in Australia who get it. Um, the assessment started to create some jobs in that space, but they've been some of the first to go with the COVID situation. And also people, they bring them in to do the assessment and write these case studies for, you know, this short period of time. And then because it's 4 or 5 years between assessments, they just get rid of them all. And then they all have to go find other jobs, and then they just bring in consultants. So they tend to use a consultancy model. A lot of the universities now internally, their research management is really starting to come together with some strategies and guidance and helping people with those elements of their grants for sure. But what we find is even when you give someone a handout with exact steps to follow, when you read it, it's a different way of writing. I don't know if you found this, but even with the broader impacts, but it's a different way of pitching your message and writing. So even when they follow the instructions, if they write traditionally like an academic, it just doesn't fit. So the value and the people that we work with is actually that we go through, we read it, we reword it, and then we meet with them to explain how to reword it. Because otherwise it's still not going to have the punch it needs, and it might still be too technical, particularly those in the fundamental and basic sciences. Like, wow, like some of them you just can't even understand. It's like reading hieroglyphics. So you just, you really do have to kind of go, okay, let's get this really back to basics, particularly if you've got someone reading it who isn't a scientist or isn't in your discipline, and that's what we have a lot of at the moment.
Yeah, well, and what I was going to say is I think that for the most part, people are still writing their broader impacts the way they write their science, but it may not be as much of an issue here because the people who are reviewing all those proposals are their peers and exclusively their peers. So that's what they're used to reading anyway. But I do think that it becomes a bigger issue when you think about the fact that what they're discussing is how to communicate their work to broader audiences. And if they can't do that in a way that's accessible to broader audiences, then they're not going to be successful with their engagement. So, but for the time being, I think we still talk a lot about how do we get our population of our reviewing pool, the pool of people who are doing reviews, to understand better what the goals and objectives are, and how can we help them to do a better job of giving feedback on the broader impacts. We have a long way to go with that, I think.
Yeah, and I think, if you have any success, I've been asking our funders if I can train their peer reviewers, but they've not said yes yet, because I think that they need to be trained and they want to be trained, but they just don't do it. Because I think, there's a lot of people I see who shouldn't be getting the scores they're getting. And unfortunately, there's people who should be getting good scores who aren't getting them because people don't understand impact. And it's heartbreaking because people spend so much time writing these grants and putting blood, sweat and tears into it,
Yeah, absolutely.
So if you come up with a way to get the funders to work with you so you can actually train them, let me know what we do.
Yeah, we're figuring it out too. So I think clearly what's going to have to happen is ARIS is going to have to send Megan and I down to Australia on a fact-finding mission. So you ready, Megan?
Yeah, let's do it.
I feel like I could do that. Yeah.
So
I'll host.
Sarah had to leave apparently, and so Mary Beth has just deputized me to be the one to wrap up. And thank you. I noticed it's 3:59. So if anyone has any more or any questions that they're dying to ask, now would be your chance. But I want to thank you, Tamika. I wasn't very familiar as I should have been with the way things work in Australia, and I really learned a lot, and appreciate you taking the time to do this. And we hope to see you at an ARIS summit at some point in the future. Have you been to NAVI meetings in the past? Or?
Yeah, I came last year.
Yeah.
Oh, okay, great.
Yeah, my first one. Oh, that's okay. Right, Arizona. Oh, it's so warm.
Yes. Well, thank you all, and thanks to everyone else for attending. We really appreciate it. I believe we've been recording this, so I imagine it'll be posted on the ARIS YouTube site at some point if other people want to share this with their colleagues. But Tamika, it was wonderful. Thank you very much.
Yeah, no worries. Great to see you guys, and thank you so much. I hope it was of interest. And yeah, you didn't need to know anything about the Australian context. It's changing a lot at the moment. So yeah,
Good.
But great to see you guys. Thank you.
Right.
Have a wonderful rest of your afternoon.
You too.
Thank
Thanks,
you.
everyone.
Okay, bye.
Bye.